Hello and welcome to my collaboration and leadership video for NurseFlex PAC 4010, Leading People, Processes, and Organizations in Interprofessional Practice. My name is Brianna Sun, and today I will reflect on an interdisciplinary collaboration experience, noting in which ways was either successful or unsuccessful. I will then review a case study and analyze ways in which the communication in the scenario could have been improved. I will identify how poor collaboration can result in inefficient uses of human and financial resources, and reference various authors and research to support my theories. I will use literature to define and identify best practice for effective communication between interprofessional teams. I currently work as an ICU nurse in a CCU unit. Recently, we had a GI patient who was post-lap chole. He had an 8-inch midline abdominal incision that was clean, dry, and intact. And his lower right abdomen had a JP drain that had been draining serosanguinous fluids. That morning, the patient had a upper GI series scheduled. The GI series was completed and no problems were identified. After the GI series, the patient's NG tube leaked out onto his bed. We took the prudent course of action and cleaned the patient, changed his sheets and his gown. When we did this, we had to maneuver the patient, rolling him from side to side. We ensured that no lines had been pulled. However, after his bath, the patient began complaining of severe abdominal pain radiating from his right side. He rated it a 10 out of 10 numerically. We administered his PRN hydromorphone. 30 minutes later, we reassessed his pain levels. He continued to rate them a 10 out of 10, saying his pain was unrelieved. He had associated nausea, for which we administered PRN Zofran. At this time, we noted that his drainage had changed from serosanguinous to green. This was a cause of concern for us, along with the pain, so we contacted the provider and informed him of the situation. After the provider had been apprised, he informed us that he had reviewed the upper GI study and that no problems were identified. Therefore, all we could do was continue supportive care. In my opinion, this is an example of ineffective interpersonal communication. I would have liked to have seen new orders for how to manage the patient's discomfort and pain, and for the physician to have come and reevaluated the patient for any acute changes in condition. However, it was also effective in that the physician was apprised of the situation. The patient did not suffer any negative outcomes. Reflecting on this situation only serves to benefit my nursing practice. Personal reflection on your nursing practice gives you the opportunity to see how and where you may have failed and improve outcomes in future events. You may even be able to find articles and evidence-based practice on an experience that you're struggling with. Not only that, but you may be able to find evidence-based practice to help you in the future. This is only available to you if you reflect on your practice and recognize that there is opportunity for personal and professional growth. In the Collaboration for Change assignment from Capella University 2021, ineffective communication was displayed on multiple levels between professionals across an entire healthcare system. The system administrators decided to implement a new system and hired an implementation coach named Josh. Josh was self-assured and knew how to work his system. What he didn't take into consideration was the staff. Each individual stated that Josh failed to listen and implement suggestions or even consider possible issues. They pointed to hospital administrators being the source of this problem because they did not believe that the administration had their best interest at heart, but rather saving a dollar. The care staff also became frustrated with a new system, IT, and management. They began to take it out on each other, even going as far as to refuse to assist each other. One even stated, "I figured it out, why can't you?" while she refused to help another co-worker learn the system. Each discipline seemed to lay blame on each other and upstream, without taking any steps to overcome the hardships as a team. In short, none of them were doing their part. Kelly M. and Associates in 2017 in their paper, The Nurse-Physician Communication, recognized that intraprofessional communication was still inefficient even with current tools available. They proposed cross-training, among other interventions, saying that research was still needed, but that organizational and cultural changes need to happen to overcome ingrained practices that are impeding communication. The heart of the study was indicating that it had to deal with the different practices, not understanding each other or where they were coming from. That cross-training may help bridge that gap. Poor collaboration can result in wasted human resources and financial resources. Terkelson said in his study, Improving Nursing Communication Using Simulation and Nursing Crew Resource Management Strategies in 2017, that when proper training and techniques were used for effective communications, hospital stays were shortened, mortality rates were dropped as much as 18%, and even 50% in the case of one OR used in the study. It goes to say that when poor collaboration is in effect, the hospital will be using more resources to keep patients in rooms longer, and for effectively no reason. In the case study, we saw that the hospital administration had paid for an implementation coach to come to the hospital, but even after he left, the system had not been successfully implemented, and that the nurses and care staff were not understanding the system. This was an ineffective use of human and financial resources. Liu W. and his associates in 2016 made it clear in their article, Creating Opportunities for Interdisciplinary Collaboration in Patient-Centered Care, that safe and effective care for patients can be achieved when frequent communication happens between disciplines. He highlighted the differences in disciplines and emphasized the importance of effective communication. Terkelson recommended the following strategies. 3 W's that prompted users to say what they saw, what they were concerned about, and what they want, and then to implement them with 4 steps. The first step was to state your concern and say what you see. I'm concerned or I'm uncomfortable with, to offer a solution and to get resolution. By the end of it, you would ask, do you agree, for a resolution? Because this would prompt the person you were speaking to make a decision based on the information that you've offered. In this study, the nurses were trained to use these tools in an escalating fashion, initiating the chain of command. If these communication strategies had been used in the case study, we may have seen a different outcome. interprofessionally if the administration had sat down with their staff and they were able to say what they had seen, what they were concerned about, and offer a solution and then get resolution, it may have had a very different outcome. Thank you for listening to my reflection on both my personal experience and on the scenario.